A lot of people think that hospice is right at the end, and that's not always the case. My name is Kathy Merker, and I'm a registered nurse, and I'm the clinical manager of Ohio Valley Hospice. I have been in the acute care world and the trauma world for 23 years, and then I lost my mother, and we had put her on hospice. And one of the things that my mom and I had talked about prior to her passing was that I had always thought about hospice. It was just always there, helping patients just pass peacefully. And when she passed, I waited about a year, and then I applied and started my journey. I've been with the company for 7.5 years. I was a case manager out in the field for 6.5 of those years, and then I've recently moved into the office. As the clinical manager, I work with the nurse case managers and the STNAs, and we coordinate care for our patients. I work with the social worker and the chaplain because as hospice, we look at a holistic approach. Depending on what the patient needs, we can get equipment in place. We work with different medical equipment companies and supplies, because if a patient has a complex medical problem, there's a lot of moving parts to that. So we kind of plug in as far as that goes and then manage the team. At Ohio Valley Hospice, our care is for everyone. It's an idea as well as a company. It's a way of thinking about taking care of patients. It's on the ground, at the bedside, being there at what can be the worst time, but it can also be a time of beauty. And that's what Ohio Valley Hospice is here to do.